Hello, my name is Kapena Kamakabiba-Oli. I'm a PA student from the University of Pittsburgh, and I'm going to be performing a head, ears, eyes, nose, and throat exam on you today. Is it okay if we continue?
Mm-hmm.
Perfect. And before we begin, can you get your name and date of birth, please?
Elizabeth Amasquito, 3/20/2002.
Awesome. I'm professionally dressed with my name tag exposed. Patient is on a clean bed with a clean piece of paper torn and folded at the edge. I perform hand hygiene prior to interacting with the patient. So we're first going to start with your head. I'm just going to inspect the head for any color changes, edema, erythema, any masses that I can visually see, any lesions. Do you have any pain or tenderness in the head or face area before we begin?
No.
Perfect. So I'm just palpating for any deformities, any masses, any tenderness here. Perfect. And then we're going to start with your eyes. Do you normally wear glasses?
Yes.
I see you wearing glasses here, so let's leave those on while we're testing your eyes. We're going to start with the Snellen chart. That's going to be about 6 feet apart here. I'm going to have you start first with your left eye, so with your right hand. I'm going to have you cover your right eye for me, please. And then on the lowest line that you can visually read, I want you to read from left to right, please. Go ahead.
LTFPH.
Perfect. Now go ahead and relax the hand. We're going to try and cover up that left hand with that left eye now. And then with your right eye, you're going to read the lowest line you can from right to left now.
HPFTL.
Perfect. Go ahead and relax. So now we're going to test your peripheral vision. So I'm going to move my hands forward. One at a time. You're going to tell me when to stop when you start to see that, okay?
Stop. Stop.
Perfect.
Stop. Stop.
Perfect.
Stop. Stop.
Perfect. Okay, good. So now we're going to check your pupillary reflexes. Could you take off your glasses for me, please? Awesome. So, first we're looking at direct. Go ahead and open your eye. We're going to shine this into your left eye first here, okay? Perfect. I'm going to give that a second. And then we're going to check consensual reactions with the right eye, shining the light to the left eye, okay? Okay, perfect. And we will be doing the same thing on the other side there. Perfect. Now I'm just going to inspect your eyelashes, your eyelids, your sclera, your irises, your pupils here. I'm going to pull down, look at your conjunctiva, your pupillary conjunctiva, your bulbar conjunctiva. We're looking to see your lacrimal glands, your lacrimal ducts, make sure there's no cysts or edema, erythema there. And then I'm going to actually have you follow my fingernail here, okay? Good. Perfect. Okay, good. So, lastly, I'm going to have you leave your glasses off for right now. We're going to check and actually look into your eyes with the fundoscope here. So, if I'm going to look into your left eye, I'm going to take my left hand. You're going to have a bright light going into your eye. We're going to start about 15 inches apart, and then I'm going to slowly move in, okay? Let's see. Okay, perfect. Okay, perfect. Now when I was doing that, I was looking for, or I was checking the disc color, the clarity, the size, and the shape. I was looking at the retina, the arteries versus the veins, seeing if there's any hemorrhages, any masses, any lesions on there. And then I was looking at the fovea and the macula, looking if there's any hemorrhages, exudates, or cysts there. So that concludes our eye exam. We're going to move on to our ears now. So first, I'm going to just inspect the external ear, look at the bony prominences and soft tissue surrounding the ear from there. And before I begin palpating, do you have any pain or tenderness in that area?
No.
Okay. So I'm going to first pull on your helix here a little bit, and your tragus there, and then mastoid process there. Any pain or tenderness?
Mm-mm.
Perfect. So now we're actually going to look inside your ear here. So with this, I'm going to need you to keep your head completely still as I'm looking into it. Since we're going into the left ear, I'm going to use my left hand and my pinky to brace as I'm looking into it here. I'm going to pull, since she's an adult, I'm going to pull the auricle up and slightly away. I'm first inspecting the canal. I'm looking at the canal for any edema, erythema, any cysts there. And then I would move on to the tympanic membrane, looking for the cone of light, any erythema on the tympanic membrane, and the bony prominences there as well. From there, we're actually going to test your hearing a little bit. So we're first going to start with the whisper test. I'm going to cover the tragus with one side, and I'm going to whisper into the other side of the ear. a 2-syllable word that I want you to repeat back to me, okay?
Football.
Perfect.
Pittsburgh.
Perfect. Okay. So now we're going to do what's called a Weber test. So this is a tuning fork. I'm going to place this right above your head here. You're going to tell me whether you hear it more on the right side, left side, or more centrally, okay?
Centrally.
Perfect. Okay. So now we're going to place this right on the bony prominence on your mastoid, right behind your ear. You're going to be able to hear it. You're going to tell me when you stop hearing it, and I'm going to move it to the front of the ear from there, okay?
Okay.
Perfect. And that would be done on both sides as well there. So that concludes our ear exam. So we're first now going to move on to our nose. I'm first going to visually inspect the nose for any edema, color changes, any visible masses. Now before I palpate, do you have any pain or tenderness in that area?
No.
Perfect. So I'm checking for the crepitus, the patency here. I'm going to include one side of the nair. Can you breathe out of the other side? Perfect. And the other side? Perfect. I'm also going to check the maxillary and frontal sinuses as well. Any pain or tenderness there? Awesome. So now I'm going to actually inspect inside the nose. I'm going to have you look up about 15 degrees, but because she's looking up, I'm going to keep my otoscope straight and level. That way I can look straight back into it. Ready? Okay, perfect. Okay, and then we'll check the other side. Pretend that it didn't fall off. Okay. When I was checking that, I was actually looking for the mucosa, the septum, making sure it's even. I was looking at the turbinates and making sure there's no septal hematoma there as well. Now we're done with the nose. I'm going to move on to your mouth and your throat. We're first going to start with the mouth. So can I have you open up your mouth for me, please? And go ahead and say ah for me. Awesome. Okay, go ahead and relax. So when I had to do that, I was looking at the teeth, at the buccomucosa, the gingiva, the hard and soft palate, the uvula, making sure it was midline. And if there was any tonsils present, I was checking to see if there's any edema, erythema, or exudates on those tonsils as well. Before we begin palpating, do you have any tenderness or pain on your teeth?
No.
Perfect. So now we're going to do a teeth tap test. I'm going to tap each tooth, making sure that you have no pain or tenderness around there. Perfect. Okay. Awesome. No pain or tenderness there, correct?
No.
Awesome. So now we're just going to look at the neck here. I'm going to inspect it. I'm going to check to see if there's any shadows from the thyroid here. Awesome. Perfect. I'm inspecting the trachea, making sure it's midline, that I can see no obvious edema or main masses here. And then I'm going to auscultate for your carotid first before we begin continuing, okay? So you just sit nice and still here. Perfect. One more time. Okay, awesome. So now I'm going to actually palpate here. I'm just going to palpate your trachea, making sure it's midline here. I'm checking for your parotid glands, your salivary glands here. Perfect. Okay, now we're actually going to check your lymph nodes now. So I'm first going to start behind the occipital, and then postauricular, preauricular, parotid, tonsillar, submandibular, submental. We're going anterior cervical, posterior cervical, supraclavicular, infraclavicular, and then now we're going to check in some of the axillary area, okay?
Mm-hmm.
I'm going to have you lift up this here. We're first going to check in your pectoral area, subclavicular, we're checking for this, I forgot this one. Axillary here, lateral, and then epitrochlear here, okay? And that would be done on both sides as well here. We're then going to move on to inspecting your thyroid gland, making sure I don't see any obvious deformities or masses. Do you have any pain or tenderness before I begin palpating?
No.
So I'm first going to begin palpating here. And then I'm actually going to go behind you and continue palpating my neck. My hands are going to go around your neck here, okay? So I'm checking the parotid, the thyroid cartilage, the cricoid cartilage, the lobes and the isthmus, I'm checking the size, the shape, the consistency, and the tenderness. There's no tenderness or masses there. Perfect. Now can you take this cup of water here, and I'm going to have you take a swallow, and I'm just going to inspect to make sure there's no masses that move up. Perfect. Okay. And if I did notice any masses or any abnormalities, I would then auscultate the thyroid cartilage there for any breweries itself. So that concludes our head, ears, eyes, nose, throat exam today. I'm ensuring the patient is properly dressed after the exam. I'm performing hand hygiene prior to exiting the room. Thank the patient for their time and exit the room.
You want to record it now?